So I am absolutely delighted, honoured to be asked to open this session of the Leg Club Conference. And I think this is a very special one because it became something we did every year. It became something that we were very used to. And to lose it for 4 years has been heartbreaking because for me, this conference is not just about sharing education, it's very much about networking and support. And every year we see a lot of people we know, but every year we see a lot of people we've never seen before. New people coming to learn, to absorb, and becoming part of what is the Leg Club family. And to me, Leg Club feels very much like a family. You make friends here that you have for life, and you network with them and you support with them. And I think that ethos of the Leg Club is what has carried us through. So I have known Ellie for far longer than I care to mention. And I can remember the first time I ever met her, I was in my first ever tissue viability post. I was working up in Halifax in West Yorkshire. And I got this phone call from a district nurse in Suffolk. Would I go and speak at a study day? And I glibly said yes, not really thinking about where Suffolk was. I didn't really know. And I remember driving down and driving a very long way down the A1. And the days, when you had a map and you had to look, and turning off the A1 and thinking I was nearly there, and then like 2 hours later actually getting there. But the passion from Ellie then, which I think was probably 95, Ellie, I was trying to work it out sometime around then, was amazing. And that passion has carried us through. And what, to me, is the ethos of the Leg Club is the person-centred care. And I just want to make a point of the difference between person-centred and patient-centred. Because I think in the NHS we talk a lot about patient-centred care. We put the patient at the heart of what we do. And I hadn't really appreciated until I went to a conference about pressure ulcers just a few weeks ago and heard a lecture from an Australian colleague, how striking the difference between person-centred care and patient-centred care is. Could any of you articulate it? If I jumped on one of you now and said, what's the difference? Would anybody want to tell me? Or would you all prefer it if I explained it to you? Yes, that'd be easier, wouldn't it? Person-centred care is about achieving clinical outcomes. It's about we take the patient into consideration, but our goals are still focused on clinical outcomes. Person-centred care is about that patient's wants and needs and desires. It's not about achieving our goals and outcomes. It's about listening to the person as an individual. Whether that person is what we consider the patient or whether it's actually the clinician. So person-centred care also considers what it's like for you guys being people, dealing with people. And how often does that happen in the NHS? Do you feel your views are considered? Do you feel your managers realise what it's like for you at the minute in an organisation that has no staff, that is driven by key performance indicators, that is permanently investigating things and seeking to blame people? Do you feel you're important? Do you feel you are cared for? And that's what person-centred care tries to bring to the fore. And for me, that's what Leg Clubs are about. They are delivering care, but it's almost like the care is incidental to the people that they are doing that with and alongside. And it's very much the atmosphere in those Leg Clubs that the people are what is important. Understanding what matters to them is what is important. And in doing that, we enable better care delivery. Think about all the patients you see that we label non-concordant or non-compliant or non-adherent or whichever word you use. Do you think those patients are deliberately difficult? Or do you think most of the time we just haven't grasped what's important to them because we don't have the time in our workload to get to the bottom of what's happening? And I think that's what the challenge is. We are so short-staffed, we are so driven by targets, we don't have the clarity of mind to be person-centred. And I really think the Leg Clubs are a person-centred approach to care. And you will see that throughout the sessions you've got today. All of the people who are presenting to you are thinking about the people that are important to them and what's important to those individual people. They will focus on their journeys and what we can do to achieve health and well-being for those individual people as they go through their journey with us, whether that's in the NHS or in the private sector. And that really has to be a new way of thinking things. In our workshop yesterday, we talked a lot about this focus on people with venous leg ulcers, but the lack of focus on people with venous disease. If you had a disease, would you rather have preventative care or management of a symptom? We don't focus on prevention of leg ulcers when we could. We could do a lot to prevent leg ulcers occurring. We could do a lot to prevent those distressing symptoms of venous disease, that pain, that burning, that itch. And we really need to think a little bit more about what we do. So from me, I hope you have a fabulous day today. You've got some amazing speakers, make the most of them. Make the most of the networking. Keep that person-centred care at the heart of everything you do, because that's what really makes a difference. That's what your patients remember about you, is that you cared about them. Thank you very much.